In my experience, actually, prostate cancer is one of the most tricky cancer. It's very tricky, it's very resistant. I mean, this is why, there's this famous guy, he's in Twitter or X now. I think he's very famous streamer or something like that, and he has prostate cancer because of the COVID, and he tried a protocol and then he failed, and he is very bitter and then talking super bad. And then I know what that, because I had some prostate patients, and it's very, very tricky and very resistant, and you have to try multiple things. And I think I remember, there's a versions of the protocol because we need to adjust with the patients, and then at version 7 or 8. So the iterations it took to basically bring down the PSA and then, make positive progression finally. You should definitely look for blood glucose levels, hemoglobin A1C, and AGF1. So these are the main things. Look also for inflammation, because these are usually the drivers for prostate. And yes, so you need to be very, very active and adaptive with prostate cancer in order to make a progress. I had 2 patients today. 2 of them, they want to rush them into the surgery. And they always say, don't let them rush you into surgery. Surgery should be always the last resort. Okay, they have a reason why they want to rush you. It's part of their protocol. It's about their system. It's a quick cash out for them. You should try everything before do a surgery. So you're not gonna die. So you should take a step back, think what you can do alternatively to reduce the cancer, try to heal your bladder, give it 3 to 6 months, give it 6 months. If it doesn't work, then of course you go for them for the surgery. Don't let them rush you into surgery. Don't make surgery your first resort, because guess what? The surgery don't kill the entire cancer. So it will come back and it will metastasis. So you almost guarantee metastasis if you do surgery. So you are now within the same cancer and with new metastasis and without your bladder, with a poor digestion, and then healing becomes even way more difficult. So delay the surgery and try everything else. There's a lot of protocols. Try your best to not do surgery, to avoid surgery. And after 6 months or whatever the period, right? So give yourself a period. Then you can always come back to them so they can torture you or whatever they want to suggest. So always protect your organs. I want to say it. Don't let them rush you into surgery. Always try everything to preserve your organs. Always protect your organs. Surgery should be the last resort. If you do surgery, you will still have the cancer come back and it will metastasis. And then you will be stage 4 without, your initial organ, the prostate, the ovaries, the breast, all of these, maybe the bladder is, of course, it will significantly affect, the digestion, but they cut out the woman breast and they take out their ovaries when they are young. They take out the men prostates. These people, are traumatized for life now. And then how are you gonna heal and how are you gonna be positive when, you don't have your full organs? So it's a bad thing. It's a very, very bad thing. So never rush for a surgery unless it's a life or death situation. If you tell me, it's severe pain, the cancer is, very progressive, we need to do it as soon as possible, then maybe. Or another thing, if it's surgery with isolation, they can isolate the tumor without affecting the organ, then that would be okay too. But removing organs, no. What do you think of alkaline juice in such cucumber, lemon, bicarbonate, sodium? If we have a consultation with you on top, we will have to buy supplements. Is that correct? Does oxygen therapy? Okay, these are a lot of questions. Of course, you have to buy the supplements on the protocol regardless, because I don't sell supplements. I don't sell anything. So you just, one of my time, my experience, then you book a consultation, though you can personalize the protocol based on you and your condition and then your metabolism. But of course, you have to buy the supplements is outside me. Oxygen therapy, yes, hyperbaric oxygen therapy is great. It's a great addition to the protocol. Juicing with, I think, bicarbonate, sodium, and lemon is great. I added it recently to the protocol in the 2 days off medication. You have to take it 3 to 5 times. I think it's amazing. Amazing results. Juicing, not sure. So look, guys, so this alkaline diet, alkalinization, if you do it too much, if you take a lot of alkaline in, you neutralize your stomach acid, and then you cannot digest the supplements and you cannot digest the food to extract, the vitamins, minerals, and to actually, let these supplements work. So the worst thing you can do is overdoing this and over alkalining your blood and your body. So it should be done strategically. So for me, that's why I put it in the 5 days in, so 2 days off from the repurposed medication and everything. And then you have to do it a bit intensively and you have to do it separate with 2 hours while fasting. So this is the best, I think, combined effects. But yes, so don't overdo it.